26 and under, staying on your parents' policy. These are the formulae for success that allow us to go forward with much more dignity, much more success, cost containment, affordability, accessibility. These are the dynamics of reform. And why would you repeal something here other than to respond to special interests?
Well, exactly so. For 8 years, in the early 90s and then in 2000, I was the insurance commissioner in California. I wish I had this law, because I could have held the insurance companies responsible. Now, my attitude about them is they always put profit before people. However, the Affordable Health Care Act has what we call the Patient's Bill of Rights. And this is the insurance discrimination that is eliminated by this law. And you spoke of a couple of these issues. Discrimination against a woman simply because they're a woman. They have a pre-existing condition. They're a woman. They can get pregnant. So the insurance companies would not cover, or they would charge more. Those days are over. Also, a young child. There are about 17 million children in America with pre-existing conditions that can no longer be discriminated against by the insurance company. They have to be able to get insurance from an insurance company. 17 million children, one of whom is the son of my chief of staff, born with kidney failure. He had insurance the day he was born. He immediately lost insurance because he had kidney failure. And today, as soon as he leaves his parents' policy, which he's able to get now under the law, because they cannot discriminate against children, he will be able to continue to get insurance. Under the old law, repeal the Obama Cares law, and he will be denied insurance because there is an end to the Patient's Bill of Rights. The Patient's Bill of Rights guarantees that insurance discrimination is over. So what do they want here? What do the Republicans want from Americans? A big question. Apparently, they want more money for the doctors, and that's certainly necessary in some cases. Apparently, they say they want government out of health care. Does that mean end Medicare? Apparently, yes, because the Republicans have voted twice on this floor to end Medicare, as we know it. You'll get a voucher. You will not have guaranteed coverage. You'll have to go out and shop for it yourself. Apparently, they don't want community clinics, because they've already voted on this floor to cut about a third of the community clinics in this nation. Apparently, they talk about access, but at the same time, they refuse to fund the residencies for family care, for the basic health care providers that we need in our hospitals, in our communities. And apparently, they want to eliminate the Patient's Bill of Rights. This is not a formula for America's health care. Now, we also heard on this floor a few minutes ago, a half hour, 45 minutes ago, that the nonpartisan Congressional Budget Office said that because the Supreme Court eliminated the mandate that states have to provide more Medicare coverage, Medicaid coverage, there would be fewer insured. True. That's true. Texas has refused to increase its Medicaid program. Well, that's Texas' decision, and I'm sure the governor and legislature will have to address that. But the fact here is that the Medicaid coverage actually provides the opportunity for some 17 million Americans to get insurance that do not now have insurance. And if we provide the clinics, if we provide the residencies for the doctors who would be able to care for them, they will have access. And I can assure you that if we also do the preventative services, we will see a decline in the number of severe cases. People will not get so sick that they have to go to the emergency room. They'll get care early, and with the drugs that are necessary, they'll be able to avoid the very expensive illnesses. That's in all of our benefit. You mentioned vaccinations. These are all ways of reducing costs. So here we go. Once again, debating something that is now the law, that is proven to provide services to Americans, whether they are seniors or whether they are young, whether they are children. It works. and it's working for America today.
Well, if I might,
Please.
ask the gentleman from California if he would yield. I believe there's a whole lot of political posturing going on with the Medicaid decision by states. And, you know, you're hearing a lot of talk about, well, we're not going to pay for that portion because, well, while it may be 100% in the near future, it may go to 92, 90%.